you all today. A few things to mention before we get started with our presentation today. This webinar is being recorded and it will be posted to our YouTube channel afterwards. An email will also be sent out to everyone who registered with a link to that recording. You are all muted and camera function is off. However, please feel free to introduce yourselves with the chat function. You can also ask questions throughout the presentation using the chat. There's also a Q&A feature at the bottom of your screens. You can ask questions through that option as well. Please feel free to enter your questions at any time. We will have time towards the end of the presentation to answer all of your questions. Other than that, I believe we can go ahead and get started. So our presentation today, just a second. Our presentation today is titled Opioid Awareness and Narcan Training, and our presenter is Josie Deutsch. She is a certified nurse practitioner for the Sisseton-Wahpeton Oyate on the Lake Traverse Reservation, and works in the Tribal Opioid Response Project funded through SAMHSA. So with that, I'll go ahead and hand it over to Josie to introduce herself further and go ahead and get started.
Okay, gotta bear with me a little bit. My name is Josie, like she said, and I do work with under the ADDICATION Field Health Clinic. We're trying to implement that here. I just wanted to say first, thank you so much to Shannon and Andrea for bringing me in and asking me to be a part of your webinar series. Sounds like they're doing great things over at the Great Plains Good Health and Wellness Board and Program. And I'm just excited to be here. I know they do focus on prevention and different things surrounding prevention, healthy foods, tobacco, diabetes, heart disease, all of those things. And so I just want to kind of bring the prevention to opioid overdose and then kind of give you a foundation on prevention and what to look for, what you can do. And then hopefully after this, you will feel confident in being able to give somebody Narcan. I do just like to mention that I like it to be informal. So if you do have questions or you think of something, anything like that, please put them in the chat. We can try to answer them. It's easier to kind of do it as we go and have discussions. I am able to use the same training I do training for all of our officers here, the tribal, city, county, police officers. We have 3 casinos that are close to us, so I do the security training. And then I'm also able to go into the treatment centers and do training for each cycle. I do the youth training, and pretty much anybody who will listen to me, I give the Narcan training to. I feel like it's necessary for everybody to know. It saved lives. I have lots of different examples. If you know of any examples, feel free to jump in. So we will go ahead and get started. I usually I kind of like to talk about if you know anybody that's using prescription or non-prescription opioids, if you have ever used Narcan, if you've used Narcan, let me know if you feel comfortable doing so. And then I kind of want you to self-reflect a little bit on how willing are you to use Narcan, how important you think it is for first responders to use it, that kind of thing. Kind of think about how you feel right now about it. Maybe you don't know about it, maybe you do. Maybe you know somebody that's been saved with it, maybe you're not sure, and that's okay. And then after the training, I want you to think about it again, and then, you know, hopefully you've made a little progress, at least if you understand, you're educated more about opioids and all of those things. And then we'll visit with that again. So I like to start out with what are opioids? A lot of people forget the different kinds of drugs. There's lots of different kinds of drugs, especially when I'm talking to the officers. You know, some people like blanket drug use. Oh, they're on drugs. Well, on the health side of things, it's helpful to know what opioids are or what specific drug somebody's using, because we treat them a lot differently and there's different options depending on what people are taking. So we're going to talk a little bit about opioids first. Opioids are naturally found in the opium of the poppy plant. So some medications are made from this plant, while others are made by scientists in the lab. Opioids have been used for hundreds of years to treat pain, cough, and diarrhea. So you probably are familiar with some of the opioids. So we call the natural opiates, or those that are from the poppy plant in kind of their natural state, that would be opium, morphine, codeine. Some people kind of like to use that interchangeably with opioids, but opiate really is kind of that natural form still. So there's semi-synthetic opiates too, which are part natural and then something's added to it. So heroin isn't a medication, but it is an opioid. It has some natural things in it and something else is added to it. Hydromorphone, hydrocodone, oxycodone, those are kind of like a combination med. So part of it is opioid from the poppy plant. The other part is like a Tylenol or something added to it. Okay, so that's kind of semi-synthetic, part natural. Fully synthetic opioids, which means all man-made or all made in the lab, that would be your fentanyl and your methadone. Those are examples of those. So I just want you to know that there's a lot of different opioids, including morphine, Dilaudid. There's a whole list over here. Some are more common than others. We in our area have fentanyl. Fentanyl is in our area. Mostly the counterfeit pills that we're seeing right now. But I want to remind people that fentanyl can come in all forms. It can come in a powder, it can come in a liquid, it can come in a pill, it can come in a patch. And so when somebody says, they were on fentanyl or they're taking fentanyl, that kind of matters, what kind of fentanyl they're taking. We also have these Vivazen or these kratom products. I'm sure if you look next time, they're right here. Next time you go to the grocery store or the gas station, see if you can see these there. They're all over the place, and it says on here, herbal supplement. So this actually has kratom in it, and it is an opioid. You can test positive on a drug screen. We can see it, through our lab that's in your system. And so it is just kind of scary because that is something that's not FDA approved right now. A lot of people are using it. Some people are advocating for it. We don't know, what is all added into there. So I think that's kind of scary. There's a lot of street names too. Apache, China Girl, Dance Fever, TNT, Purple Passion. I think there's like a gray something and a blue something. The patches sometimes are called boxer's patch, because boxers sometimes after a fight, they'll get like a fentanyl patch put on them by the doctor there. So I had mentioned the counterfeit fentanyl. So this is I don't know how you'd say it. This is a bag of pills that was confiscated about 3 hours from where I am, which is in Sisseton. And this, if you look closely, it looks kind of like the same medication, right? So this is about $40,000 worth of oxycodone or Percocet, Perc 30, Box 30, something like that. But if you take a closer look, so if you look in this middle picture, it's a close-up of the bag, you can actually tell that there's two different pills here, right? So the oxycodone or the Percocet, the real Percocet is blue and a little bit thicker. And so the fentanyl is green and a little bit thinner. So this is a close-up of the green one. So this is actually fentanyl that is pressed to look like oxycodone. So, a lot of things play into people that have a use disorder. It depends on what opioid they're using. Remember, they come in different forms. So what form they're using, what route they're using. So like these pills, you can swallow them. So that would be oral. That would take a little bit longer to digest, right? Because that goes in your stomach. Versus somebody that crushes one of these up and snorts them. You can heat them up. They do a lot of different things. And so the route matters as well. And so when people ask me specific questions, we don't always know the answer because a lot of things play into that. So I use this with the youth, and I think it's important for everybody. I'm a really visual person. And so we need to remember there's a lot of different strengths that come into play too. So opioids are measured in morphine milligram equivalents. So when I was first a nurse, I remember morphine was our big gun. I worked in the ER and we used morphine for chest pain, for childbirth, for trauma, for accidents, for everything, right? Morphine. So when I first started doing this and I found out that fentanyl can be 50 to 100 times stronger than morphine, I was floored. I was like, oh my gosh, this is bad. I can't believe anybody would use that. You know, those kind of things. So you can kind of see here, Tylenol number 3, Tylenol with codeine would be, you know, not so high. Hydrocodone, morphine are kind of similar. Oxycodone's a little stronger, the Percocet, and then the fentanyl is a lot stronger, right? So this is kind of concerning because depending on, like I said, how people take it, what the dose is. So this is just kind of straight across the board here, what the measurements would be. But remember, you can order it in different strengths. So you can order 10 milligrams versus 5, something like that. Which route you take it, what the metabolism is, what your tolerance is, all of those things. Kind of makes sense there. So when we talk about overdosing, how much would it take to overdose? So tramadol is kind of on the lower end of the opioids in strength. So you'd need quite a bit of tramadol. Heroin, kind of depending on what was all added, a little bit less. Oxycodone, a little bit less, and then fentanyl. So if we compare that to a penny, this is how much fentanyl can kill you. So I know we're in different time zones, but tonight at supper, if you try to take a salt shaker and shake out 4 grains of salt, it's almost impossible. So that's the amount you need to overdose, just 4 grains of salt, that's it. And so a lot of things, like I said, play into that. And remember I said fentanyl is all man-made or all made in a home or in a lab, right? So unless you're getting your medications or your pills from a pharmacy, you cannot be sure these days what is in it. And we've had some teens overdose here in our area, and we've had these counterfeit pills lately, and it's just really scary. And we're trying to figure out kind of what the teenagers are thinking. And I think maybe they think, oh, it's medicine, it can't be that harmful. People take it, it has to be safe. People take it all the time. And that's, you know, not true unless you're getting it from the pharmacy. I do like to include some data in here. And I've been on a few different webinars and trainings lately, and everything is just increasing. Opioid deaths are up again in South Dakota. It's here. You know, people still kind of think, oh, we don't have that problem in our area, and it definitely is here, and we're seeing it all over. If you look on the bottom left, that despicates male and female, and so it really is split. I think more of my patients are female personally, and I think that's just because they're in the clinic more, or they come for help. Maybe they ask for help easier, or they're here with their kids and they see us, or you know, something like that. The bottom right has all of the different age groups. So if you notice, every single age group is in here. Everybody is affected. We have young, we have old. The highest level is at 25 to 34. We kind of attribute that to women are having babies. So, you know, they might be prescribed an opioid, and men, sometimes they get injured at work, and so they're given opioids too. So we think that's kind of why that's higher. You know, COVID, everybody, you know, is always concerned about COVID. So those patients that have any use disorder or recently diagnosed use disorder have an increased risk of COVID-19. Opioids are at the top of the list, and that is just kind of because of the respiratory depression that comes with that. And we'll kind of get into that a little bit more, okay? So I do always want to start out with saying that opioids do have their place. We do need them for the chest pain, the childbirth, the trauma, the accidents, all of those things. So if you're in the health field, or even if you go to the doctor, you know, they ask you about your pain, right? In 1990, pain became the 5th vital sign. So if you go in, they're going to do your blood pressure, your temp, your heart rate, your respirators, and they should be asking you about your pain. So when we talk about people that misuse or have an opioid use disorder, what we mean is people are taking their prescriptions in other ways than instructed, like taking it more often, maybe taking a higher dose than prescribed, getting it and using it from somebody else, even if it is for a real medical condition. I don't know how many times I hear patients saying, oh, my auntie gave me this. I was having pain, and, you know, things can start. It's something simple like that. There was a real medical condition, and they were trying to be helpful. People that are taking prescriptions to get high, or mixing prescription opioids with alcohol or other drugs. So it really can be about life and death. Usually, like we say, anybody with opioid use disorder has some kind of exposure, either trauma or medical. Almost all the time, my patients have been prescribed an opioid at one point in their life, and it led to illegal use, however kind of that happened. And then usually there is an underlying cause. So identifying what is going on. And so that kind of leads into some of the other aspects that the health, you know, the good health and wellness program talk about. They talk about nutrition, they talk about healthy foods, tobacco cessation, and then education with other diseases. A lot of times there is some underlying condition. And so kind of finding that and figuring out and helping patients as a whole person, because as a provider, I can give anybody medicine, right? But is that going to fix what's going on at home? Is that going to fix, you know, how they're eating, or maybe getting a job or taking care of their kids? And so a lot of things go into that. And so the knowing available programs and assistance in your area is really helpful. And sometimes you just have to ask or reach out to somebody, and they'll point you in the right direction. So like she said, I originally started working under TOR as the tribal opioid response nurse, kind of like a case manager. We talk about a lot of things, like the whole person kind of thing. We help them with the primary care provider, do referrals, some non-clinical support. And now, as an extension of that, as the nurse practitioner, there is long-term treatment, which we call it medication for addiction treatment. So I don't know if anybody's familiar with the Suboxone, buprenorphine, Vivitrol. This is something that patients would take every day or every month. One of the Vivitrol is an injection, possibly for a lifetime. We're also trying to improve access to treatment and recovery services, promote the use of Narcan, strengthening our understanding of the crisis through better public health monitoring, developing safe and effective medication strategies for pain, improving medications to treat people who are addicted to opioids, and advance better pain management practices. So the medication-assisted treatment is an FDA-approved medication, and we use that in combination with counseling, behavioral health therapies to provide that whole patient approach to treatment. So I want to talk a little bit about the brain. So our brain, remember, is a circuit, and it's important for our natural rewards, okay? So is all stress bad? Do you guys think all stress is bad? I don't see any answers, but no. Oh, our stress is, sorry, I'm trying to keep up with the chat as we're going here. All stress is not bad. So that is why our brain remembers the same food, right? We always order our favorite food. Our brain remembers that. That's why we can listen to the same song 72 times, right? We remember our favorite song. That's important. If we're crossing the street and a truck is coming, if we didn't have a little bit of stress, we wouldn't get out of the way. On tests, you know, it helps us perform well. We want to do well. So a good amount of stress is good. We don't want a truck coming at us all the time though. So anything you do, use, or go through can affect, you know, your heart, your lungs, gets in your DNA, and can even get in your brain. So there are a lot of MRI studies right now on the brain. So I don't know if you've ever heard of the old saying, the lights aren't all on. And so this kind of goes back to this. This is the different chemicals that are released in the brain when different things happen. So you see in somebody that doesn't use, the lights are on, right? The hormones are right here in the ventricles. You can kind of see both hemispheres, both sides of the brain here. Somebody that's not using, the lights are kind of all over, not really as bright. You can't really identify both sides of the brain very well. And so that is what the difference. And some of that plays into the decision making, the motivation, impulsiveness, all of those things that you can kind of see with people that use. I think I've seen a big question up here. Let me just look here. Yes, you can email me and I can sure provide Narcan training for your officers in Flandreau. I will put that in the chat at the end. Thank you. Okay, so we'll take it a step further. So what's happening in the brain when somebody is using opioids? So our brain is full of molecules called receptors. It receives messages from other parts of the body. Opioids then attach to those receptors on nerve cells in the brain, spinal cord, and other organs. It blocks the pain message from the body to the brain. This causes a large amount of dopamine to be released, right? That's where the lights are lit up. That's the dopamine, that's the chemicals. We feel happy or relaxed. Okay, I know that's a lot, right? So let's say, I'm going to give an example of that. Let's say we're in a car accident, our leg is cut open, they bring us to the ER. What do? They give us something for pain, right? We feel better. Is our leg magically fixed? No, it's still cut open, right? Just that message to our brain is blocked. Our pain message is blocked. So that's how opioids work. So our brain has receptors kind of all over. And an opioid overdose would occur when too much of the opioid, like a heroin, Oxycontin, really any of the opioids, fits in too many receptors, which causes a slowing and then stopping of the breathing. So if you see here, these receptors are on the brain. This is the opioids. They fit perfectly in here. Okay. Think about this as our main highway. See how they're blocked. We're not getting the message that we're in pain, which is how it's supposed to work. So that doesn't sound too bad, right? So why is this bad? Remember, our brain remembers that feeling and we want more. A continued use of opioids, especially if there's like not a reason or your injuries healed or stuff like that. A continued use, I should say a continued unneeded use, causes an unnatural rise in dopamine, which starts to alter the connections between the brain cells, causing cravings. This is as deep and essential as eating. So stopping them abruptly causes a stress hormone to be released at catastrophic levels, which cause the opposite. So this leads to fewer receptors, loss of motivation, decreased gray brain matter. People are so scared of withdrawal because it really is not fun. And so this is why. The good news is all of that can come back in recovery. And we need that for our decision making. Our brains actually have the power to change, rest, and to undo that remapping. And with hard work and individualized treatment that addresses the whole individual, recovery is possible. Okay, I know that was kind of a lot. So we'll get into the Narcan, the naloxone part here. So there are a couple different kinds of Narcan or naloxone. So those names are the same. One's the generic name, one's the trade name. So you may hear people say one or the other. I noticed like in Minnesota, they say naloxone more. Where I am, we say Narcan, or the police will say, oh, they were canned, or we canned them twice, or something like that. So there's kind of slang for that as well. So today, though, I'm going to teach you how to use the nasal medication. So this is a medication used in the treatment of an opioid overdose with an opioid overdose signs of breathing problems and severe sleepiness or not being able to respond. So if you ever use like a Flonase or any kind of nasal spray, it's very similar to that. Does anybody have any guesses on how it works? Remember, our main highway is blocked. Good, Elizabeth, yes. So the Narcan has a stronger affinity, or the opioid receptor likes the opioid better. Our opioid receptor likes the Narcan better. So it knocks the opioids off the receptors for a short time, and then this would allow the person to breathe and reverse the overdose. So if you kind of look in this picture, you see how the Narcan, it fits in there. It fits in there pretty good, right? But it's not exactly the same fit, right? So this allows the message to get through. Okay, so the Narcan lasts about 30 to 90 minutes. It works usually within 1 to 3 minutes, so it's pretty fast. And like I said, it lasts 30 to 90 minutes. So it'll sit in here. Now, depending on how the person metabolizes or gets rid of the drug, the opioid can still kind of hang out around here. You see how the opioid's still kind of hanging out? So when the Narcan releases, the opioids can sit back into the receptors. And so if you've ever heard of somebody say they overdosed twice or in the same night, or they overdosed again, that is why. The opioid can actually sit back in there once the Narcan releases. So of course we got to include the laws in here. This is the South Dakota law. So any drug-related overdose is an acute condition, including mania, hysteria, physical illness, coma, death, resulting from the consumption of a use of a controlled substance or another substance, which it was combined, so that this person would reasonably believe to have had a drug overdose that requires medical assistance. So this kind of covers all of them, right? So somebody that's overdosing on opioids, you wouldn't see the mania and hysteria. And so I'm going to describe that a little bit. So our body always, all the time, tries to maintain this homeostatic state, this normal level, this kind of mid-level, all the time, right? Even when you're having anxiety or you get worked up about something, our body's like, okay, settle down, right? Our body's always working all the time. If you have high blood pressure, it's trying to work to lower that. So think about what's happening to somebody when they're using meth. So we know that meth is an upper, okay? So think about what's happening inside the body when somebody's using meth. It would be like a bear is chasing you and you're running super fast, and oh my gosh, this bear is chasing you, and your heart rate's really fast and your blood pressure is really fast and you're breathing super fast and your pupils are big because this bear is chasing you and your gut's going crazy. You probably have diarrhea. All these things are speeding up, right? Everything's up. And your body's like, hold on, slow down, slow down. Okay, and our bodies are kind of good at that because, you know, with our normal life, it does that. Okay, so think about opioids are a downer. There are other opioids like alcohol, sleep aids, muscle relaxers, benzos, which would be like your Valium, Xanax, alcohol. I don't know if I said that already. So think about all of those things that are downers. Those are downers as well. But remember, opioids have their own receptors, okay? So think about what's happening to the body, inside the body, if somebody's using opioids. It'd be like you're on the beach and it's so quiet and you can hear the waves and your heart rate slows down and your blood pressure slows down and your breathing slows down and your gut slows down. You're probably constipated. Don't fall asleep on me. And your pupils are really tiny because it's so bright and beautiful out here. It's just perfect, right? Well, our bodies have a little bit harder time, like, hey, wake back up, right? Come on, wake back up. Because remember, some of those highways are blocked. Those receptors are blocked. We're not getting the messages to our brain. So what happens when our receptors are blocked all the time with opioids, our brain kind of tries to make like country roads to get like the messages around. And that's why in the MRI picture that I showed, that's why some of the lights, you'd say, are kind of sporadic. They're kind of all over because our bodies are trying to adjust to that. And they're trying to get the message through. But with opioids, they're blocked. See how that kind of makes sense? So somebody that's using meth will look completely different than somebody that's using opioids. I'm getting to the tribal laws. So the South Dakota has a law about using Narcan, and our tribe has our own law. I can send you the link for that too if you do want that. So we have what's called the Good Samaritan law. And so this just means that if you give opioids in good, or if you give Narcan in good faith, somebody can't come back and sue you. So some people that are using When they overdose, they don't remember that they overdosed. And so a lot of times they'll wake up and they're upset and they're, worried, depending on, like, if you, especially when with the officers, when they're in uniform and they wake up to somebody that's in uniform, that's really scary for them. They'll sometimes take off, that kind of thing. So this covers you. If you give it in good faith, they can't sue you or anything like that. Yes, let me see if I can grab the link right now. No, I can't. Whoops, but I will get it to you. Okay, so how are we going to recognize somebody that's overdosing? So remember kind of what's happening to the body that we went over. How would you wake somebody up? I've always heard a lot of different things, like put them in the shower, shake them, do all kinds of things, right? So really the only thing that you need to do is make a fist with your hand and use your knuckles and then rub them over the middle part of their sternum. So it's called the sternum rub. So if we rub right there, trust me, nobody likes that. They will usually wake back up or respond if they can. So there's other signs that you can look for as well. I know when I train the casino staff, sometimes they say, oh, they're just drunk, especially if they've had like a rough night shift or something. Oh, they were just drunk. And I said, well, what if they didn't have a drink all night, or they didn't have a drink in front of them? Then what would you think? Maybe they would have a bag. I joke sometimes because I have ibuprofen, I'm getting a little older, carry ibuprofen around, and you can hear them shaking in my purse sometimes. And I'm like, yep, you can, there's other signs that you can look for. So when somebody is overdosing on opioids, they are going to have that slow or absent breathing. They may have a gasping or a snoring sound, like the death rattle. I don't know if anybody's ever heard that. If you hear that, it'll stick with you forever. I don't know if some of you guys have kids, and do you ever, watch your kids sleep, and sometimes they're sleeping so soundly and you're like staring at them because you don't know if they're breathing or not. That's how they're going to look. You're not sure if they're breathing or not. And remember, they're going to have those tiny, tiny pinpoint pupils. So think about if you find somebody passed out, and think about what our pupils do. Even now, our pupils are reactive, right? So when there's more sunlight, our pupils will adjust and they'll react. They'll get smaller. Okay. If it's dimmer in your room, your pupils will get larger. So if you find somebody that's passed out and you open their eyes and their pupils are really, really tiny already, that's a bad sign. Because normally when your eyes are closed, your pupils should just kind of be at rest. And when you open them, they will adjust to the light. Okay. So if you open them up and they're really, really tiny, that's a bad sign. That can also mean heart. Let's say one's small and one's big. That could mean a stroke or some kind of, pressure in the brain, something like that. Our pupils can tell us a lot of things. When our body is trying to save itself, it'll shunt all of the blood to the organs in the brain. And so you'll start to see those blue-gray lips and nails. You want to make sure that emergency medical services have been called. Remember, if somebody overdoses, they might, when the Narcan wears off, they might overdose again, or you're not sure what they're using, or maybe they used 2 different things, or maybe it's something else. We don't know. You always want to make sure that they're checked out by the ambulance. So there's a nice little acronym, BLUE: breathing, lips, unresponsive eyes. You can look for those 4 things, and that should be able to tell you what's going on. But it can also look like COVID, right? Everybody's kind of having some kind of virus these days. We actually had that in our area where a patient had overdosed and she had COVID too. And so it made me kind of wonder, like, I wonder if her family was isolating her because she had COVID, but they didn't know she was using. You never know it. There's so many things that are co-occurring nowadays that it's just better to have them be checked out. So remember BLUE and make sure you are prepared to save a life. Okay, Cynthia. So the Narcan, sometimes they'll have to give, Cynthia asked in the chat, what happens after the ambulance gets there? What treatment do overdosers receive after they get to the hospital that actually takes out the meds? Is it flushing of their system? So no, they may have to be given the Narcan a couple times until the opioid is cleared. That just kind of depends on what they used. So a lot of times they will give them fluids. They'll probably try to figure out what the underlying cause is. In our hospital here, they do offer that medication for addiction treatment and treatment services, and kind of help them with their withdrawal. So let's say if they wake up, they might be anxious, so they may give them something for anxiety. If they're like people that use don't always eat the best, so maybe they need vitamins. Kind of do like an overall assessment and make sure that they're doing okay. They don't really recommend, like back in the day, they used to make people throw up, or they'd give them like activated charcoal and make them throw up. They don't really do that now, but it really depends on what they took, how much they took, what they're used to taking. There's a lot of things that kind of go into that. Good questions. So a few things to remember before we give the medication. We want to make sure we have the right patient. I don't think anybody that is awake will let you give it to them, but you never know. I'll show you here in a second. On the top, there is an expiration date. There was just a study used like 20-year-old Narcan and it still worked. But I mean, so if that's all you have is an expired one or whatever, that's fine. Try to use it. So when we give naloxone, we want to lay them on their back. We would remove the Narcan nasal spray from the box. Hold the applicator with your thumb on the bottom of the plunger and your first and middle finger on either side. Tilt the person's head back. Provide support under their neck. Gently insert the tip of the nozzle into one nostril and press firmly. Pretty simple, huh? After we give Narcan, we may have to give rescue breaths. That would be the one ventilation every 5 seconds until the ambulance comes. After 2 to 3 minutes, if the patient is still unresponsive with slow or no breathing, we may have to give another dose. So if the person responds, we do want to place them in the recovery position. So there is only one kind of known side effect to Narcan, and that is sometimes people vomit. But they're not sure if that has to do with the Narcan itself or if it has to do with the overdose, because people can vomit. Remember, our bodies are working to fix it, right? So sometimes they will vomit even just from the overdose. So making sure they're on their side so they don't choke on their own vomit helps. So I'm going to turn my video back on here. So Narcan comes in a box like this. It has the expiration date right on the top. So in each, this is an expired one, in each kit here is 2 doses. So in each dose, I'll put this up on the next slide. In each dose, when you open it up, it has this little, packet. And so it kind of shows you. So if you're like, oh my gosh, I don't remember what she said, kind of look at this quick. You can kind of see the pictures here. You can open this up. You can look at it and see and remember what to do. So let's say we come across somebody and I say, hey, they're passed out. And I'm like, hey, are you okay? I'm doing the sternal rub. I'm rubbing on their sternum to see if they're waking up. They don't wake up. Oh, I think it's an opioid overdose. And so I'm going to give them the Narcan. I opened it out of my kit. This plunger is usually down like this. So I'm holding it between my first 2 fingers with my thumb on the plunger here. I would insert into their nostrils up to my fingers, tilting their head back, and then spray it. It is kind of a hard spray. And, with allergy season, all of those things, if it doesn't work right away, or maybe it only lasts a little bit, I would recommend kind of repositioning the head, and then I would give the dose in the other nostril. If you kind of noticed on here, these kits do have this kind of film, And so they do need to be protected from light and then kind of at like a room temperature. So if you leave it in their box, you know, just inside somewhere is usually the best place to keep them. So when I train the officers and other people, I do like to mention that they may have to use Narcan on each other. I think it was in Pine Ridge that there was an ambulance worker that came into contact with, yes, there is a video. If somebody that came into contact with fentanyl on scene and he actually passed away, they didn't figure it out till later. So it's really important that you keep yourself safe and you kind of get it in your mind to think of what to do. What are you going to do in an overdose situation? I can share a video. There's kind of a long video on the IHS website. Yes, I have trained some of the school staff as well. And we have different programs here, different treatment programs, youth programs, and kind of everything in between. And I have done the Narcan training for all of them as well. I've personally trained, it's getting close to 400 people that I've personally trained for overdose and to use Narcan. So Katie said we had a lady who was in hypoglycemia and responding to EMS, stating probably an overdose when she had a blood glucose of 40, but she was very lethargic and unresponsive. My question is, if she was given Narcan, what kind of reaction should she have, or none at all? So usually, they may, think about opioid kind of thing. They may have like a diarrhea, but if given Narcan, because it would reverse the opioid kind of effects, but really it's safe for everybody. So if you give it, it's just not going to work. And so then you're exactly right, Katie. If I'm working on the ambulance or anything else, I gave Narcan, it didn't work, and I really thought it was an overdose, I'd probably give a second dose. But that would come across my thinking as well. What is her glucose? Because that is also kind of how they'll look. Now, if you opened her eyes, her pupils probably wouldn't be pinpoint. There's a few other signs that you can look for as well. So nope, Narcan won't hurt anybody. Jay said, being a first responder, how can we at CPP have at least a box of Narcan in our vehicle? Well, I don't want you to leave it in your vehicle because we have, kind of extremes, but you could keep it in your bag and then bring it with you. You can come and see me, and I just want to verify that you feel comfortable giving it, and I can give it Narcan to you. But that does bring up another point. Most of the pharmacies in South Dakota have what's called a standing order. And so you can just go in and request. So anybody that's eligible for IHS here can come in, request Narcan, and then they'll give it to you. They know that you can't use it on yourself, and so that you want to keep it, for work or for, safety reasons. So you can come in to IHS and request it at the pharmacy under the standing order. Our Lewis drug here in town carries it as well. It does cost about $127 for the nasal. So it is kind of expensive, but when you consider, saving a life, that kind of thing. Cynthia, good question. No, Narcan doesn't interfere with insulin receptors. Nope, pain receptors are a separate thing. Opioid receptors have its own receptors. Good questions. So considerations to always remember, you always want to make sure that you're safe, right? You always want to make sure the scene is safe. So I'll tell you guys the story of when I first gave Narcan. It was when I was first a nurse and I was working in the hospital, and we had a patient that was a known opioid user, and she had surgery, and we were having a hard time controlling her pain. Her nurse came to me a little while later, and she had given her quite a bit of pain meds throughout the day, and she said, I can't wake my patient up. And I'm like, what do you mean you can't wake her up? And so I go running in there, and I thought she was dead. She was laying flat. I thought she was gone. I jumped on the bed, because in the hospital you can do CPR on the beds. And I jumped on the bed, and I was going to start compressions, and I said, give me the Narcan. And we had the injectable kind, and so it's kind of like an EpiPen. So I gave it to her in her leg, and the lady sat right up and hit me. And I've like never seen anybody work so fast in my life. So keeping in mind that people sometimes can wake up really suddenly and your body is going to be like fight or flight. And so sometimes they wake right up, because I'm saying it knocks those opioids off and they sit right up. And it can be kind of intense, because you're thinking they're dead for 1 second and you're thinking, okay, I got to do CPR, I got to do all this stuff, and you might have to, and then they wake right up. And so a few other things, you always want to make sure that the ambulance has been called and keep them updated. If a patient doesn't have a pulse, you do need to start CPR. If they are gasping or not breathing, you might have to start rescue breathing. And then keep in mind, naloxone or Narcan works pretty quick, 1 to 3 minutes, typically lasts 30 to 90 minutes. So a lot of times people will say, well, what if they're just high? I don't want to mess with them. The differences will be, they will respond to you. They will be breathing, maybe their pupils aren't as pinpoint, something like that. You just got to keep them kind of awake. I still get them checked out, that kind of thing. So we still want to treat people's pain, right? So like I said, when pain became the 5th vital sign, providers were being sued. They were not treating people's pain, and people were mad about that. So the narcotics companies came in and said, hey, give them these medications, they're not addictive. And we know years later that that's not true, but we still do need to treat people's pain. So Brookings Health Systems adopted this comfort menu. And so I think it's really cool, because there's so many other things that we can do for pain. And we always think we don't need to be in any pain, right? But pain is a good thing. Pain, it means our body's reacting to something. It's telling us that something's wrong. We got to try to fix it. If we just cover up the pain all the time, we don't really figure out what's wrong. I know I feel a lot better even just after a shower, right? There's a lot of things, back rub, people are getting massages. I know at IHS here in Sisseton, we have dry needling, and that's really great. So offer some other things here. So what about you specifically? How can you protect yourself, your family, our community? When we talk about prevention, it starts at home. Us as parents, we need to, kind of guide our kids, tell our kids how deadly opioids can be, how drugs can be. Children who learn the risks of drugs at home are less likely to use drugs than those who don't. Surveys show that 2/3 of teens who misuse prescription painkillers got them from a friend or family member or acquaintances. So make sure that you are keeping your meds locked up. Safe medication storage. Keep opioids and other prescriptions in a secure place. Count them, monitor them, and then getting rid of them, dispose of them. We do have drop boxes in our area in 3 different spots at both our pharmacies and both our clinics and hospitals. So getting rid of them, nobody's watching them, just go, dispose of them. Talk to your doctor. So if you are, if you do have pain, you do have a baby, something like that, discuss alternatives to opioids. Your doctor may suggest other non-addictive medicines or certain complementary or alternative treatments, like the acupuncture or the dry needling or massage. I was just on a meeting about even in surgery, they're going to kind of get away from like the fentanyl and use other medications instead of opioids. So I thought that was really cool, because, not a lot of doctors, question the anesthesiologist, and the anesthesiologist just kind of gets to pick what meds they want to use. And I guess I never really thought about that, but that's something to ask as well. Make sure you don't take your opioids with alcohol or other medications. So you don't want to mix a double downer. Remember how we talked about drugs that are downers? If you mix 2 of them with one of them with opioids, that's can be a really bad situation. Asking for help. I think Tosha came on, and so she'll talk about some different programs in your area out in Rapid. We have, things out in our area as well. And I think we have things in between too. So if you don't know, make sure you ask for help. There is quite a bit of treatment options, and we do want to include counseling and then the medication as well. And then hopefully now, after talking with me or visiting with me today, that you know what to do in an overdose emergency situation. And I hope that you feel comfortable and confident that you could give it. I do have just a couple of quick questions just to make sure that you are listening, and hopefully that You learned something today. So you guys can just put this in the chat. I will find it, Jean, here in 1 second when I'm done sharing. Okay, I promise. So you guys can answer this quick. What is important when surveying the scene of an opiate overdose and determining if it is safe? Yes, all of the above. We want to make sure everything is safe. There was one scenario that somebody still had a needle sticking in their arm. And so that would be a situation where you would probably want to take that out and put that against a wall or put that away, because if you wake somebody up violently and they still have the needle in their arm, that's not a good situation. Let's say maybe they're outside. We've had at our casinos, we've had people that are outside in their cars. You know, they may need to be brought inside where it's warm. We've had people dropped off in the entryways at our hospital and our casinos, and they're just dropped off. So you may need to move them just depending on where they are. If you have gloves, wear gloves. Here, if you have like a mouthpiece or your medical bag, you know, make sure you're taking all the precautions there. So what is naloxone used for? Or Narcan? What is Narcan naloxone used for? Yes, it has to be there has to be some type of opioid in there. So remember, fentanyl is being laced in meth. Fentanyl is being laced in weed. And benzos and other medications are, you never know what that is, because fentanyl can be pressed to look like a benzo, can be pressed to look like oxycodone. You just never know. So, but there has to be some kind of opioid in there to work. If it doesn't work, then it's not opioids. Makes sense? Okay, so common signs that indicate an opioid overdose. Would they be, or could they possibly be, unresponsive or look intoxicated? Yes. Would they maybe have blue fingertips, skin, nails, lips? Yes. Would they have pinpoint or dilated pupils? Pinpoint, good. Would they have increased or decreased respirations? Decreased. Remember, everything's slowing down. So increased or decreased heart rate and blood pressure? Yes, decreased. Everything's low, everything's down. It's a downer. Would they vomit? Maybe, probably, yes. Good job. All of those, you guys got them right. What are the age and weight limits for using naloxone? I didn't talk about it, so there must not be a big deal. There is no age or weight limit. Obviously in neonates and pregnancy, there's some limited data. If somebody was pregnant and you know that they've used or were using and you think they're overdosing, you could save 2 lives. I would give it. They do give neonates Narcan in the hospitals and that kind, in the NICU and that. So this is just kind of an FYI. Remember how I said that there's different kinds of Narcan or naloxone? So these answers are just straight across, but there's different doses. It's already pre-filled. You don't have to try to give half a spray or anything like that. So they're already pre-filled. 1 dose is in the nasal spray. So where can you obtain the naloxone with a standing order? Yep, pretty much any pharmacy has those. How should you store your naloxone? Yes, A and B. So you want to make sure it's protected from light, but if you leave it in its box, it'll be fine. And then just add a controlled room temperature. So if you have to give a second dose of naloxone, how long should you wait after the first dose? Yep, 2 to 3 minutes. And then what position should you put the patient in if they respond to the naloxone? C, the recovery position. Yep. So we want them on their side, and that is, we still want to make sure that they're still breathing, wait for the ambulance to get there. We may need to put them back on their back, to make sure they're breathing, and then put them back on their side. We don't want them to choke on their own vomit. That does happen. So we want to prevent that. So let's put these in its appropriate order. So we would want to make sure 911 has been called, check for signs of the opioid overdose, support the breathing, administer naloxone, put in recovery position, repeat if necessary, put back in recovery position, and then make sure that emergency medical attention has been done. All right, do you guys have any questions at all? Whoops. And then I think, yeah, go ahead.
Yeah, I was just going to say thank you, Josie. That was an awesome presentation. Great information. And thank you everyone for your questions and participation. Please continue to put your questions in the chat and we'll definitely get them answered. Also, I did want to mention the Q&A option gives an option to ask a question anonymously if anyone feels more comfortable asking a question that way. But like Josie mentioned, we do have Tosha Tuhart on the call with us today. Tosha is our Director of Community Behavioral Health here at Great Plains Tribal Leaders Health Board. And they do have some awesome programming and resources available here in the Rapid City area. So I did want to let Tosha just go ahead and hop on and kind of talk about their programming a little bit.
Good afternoon, Josie. That was an amazing presentation. I just wanted to highlight a couple of resources we have in addressing to actually complement your presentation. So I'll make sure that folks, Good Health and Wellness sends these in an email, but we have our Great Plains Tribal Leaders Health Board Tribal Treatment Services Resource Guide that has the contact information for all of our tribal treatment centers here in South Dakota. And then we have the opioid overdose prevention guide, which just goes over what are opioids, not the naloxone part, but how to respond to an overdose, and then the Good Samaritan laws in South Dakota, North Dakota, Nebraska, and Iowa. A couple of highlights I wanted to mention because opioid use prevention and recovery is really part of our holistic wellness. So two things that we do here in Rapid City are offering virtual yoga as a means of opioid prevention and recovery, and also alternative pain management. And then, so we have yoga offered 3 times a week virtually. And then we also do horse healing events here in the community, which is centered around healing trauma. Because as we know, our substance use and opioid use and stimulant use are really symptoms of a deeper issue. So we do those twice a month here in the community on Saturdays, and I'm actually going to post 2 news articles about our activities here in Rapid in the chat box. But yeah, we are a resource here in Rapid. We have a comic book that is downloadable on our website, and we'll have another comic book and another comic video coming out this year.
Thank you, Tosha. Yes, great resources. And like she mentioned, we'll be sending out a big post email, most likely tomorrow, to everyone who's registered. And you can then share that with anyone that you would like. We will include the link to this recording. It will be posted to our YouTube page. So we'll include the link for the recording to this presentation. We can include Josie's contact information, Tosha's. We can also include these resources that Tosha is providing in the chat. So we'll have a good resource-filled post email coming your way soon. I don't think I see any other questions in the chat. Let me just make sure.